Yes, hello my dear doctor. I'd like to talk a very important topic, that is the adult onset steel disease. So before starting the adult onset steel disease, I'd like to talk what does this disease really mean. Adult onset steel disease is separate disorders from the autoimmune disorders that usually we talk about the seropositive arthritis and seronegative spondyloarthritis. Means the seropositive, the rheumatoid factor positive, and some of the rheumatoid arthritis. And next to the rheumatoid arthritis, yes, the other seronegative arthritis are the sometimes like ankylosing spondylitis and also IBS with arthropathy and psoriatic arthritis. These are the group of disorders. And also other arthritis, some seropositivity. It includes the SCL, sometimes the SSC with the systemic sclerosis, and sometimes the Joker syndrome. So there are a long list of diseases in rheumatology that we call them autoimmune disorders. So these are the group disorders we group under the headings of autoimmune disorders. And autoimmune means the autoantibodies are damaging the different organs, especially the joints, and causing the arthritis. But now we are talking about the AOSD, and sometimes the people call the AOSD, means the adult steel disease or adult onset steel disease. Why the word the adult comes forward, my dear? The adult word comes forward because this category of arthritis or maybe the syndromes or maybe the disease usually happen in a child group of, or children group of peoples. And in that the children group of peoples, we gave a name, and most appropriate term that we used, there is the juvenile idiopathic arthritis. Means what I'm saying, juvenile idiopathic arthritis, ektu kotha nai, baire ke kotha. Juvenile idiopathic arthritis, the word itself says that it happens to the juvenile. Idiopathic means the causes we don't know, and these are arthritis. So these are group of disorders not messed up with the autoimmune disorders, but this is the juvenile idiopathic arthritis that happen to the children. And this can happen to the adult peoples, and we give a name that the adult onset steel disease, or we call the adult steel disease. I hope that we got the disease. What does this disease really mean? Adult steel disease. So it's because the juvenile idiopathic arthritis that happen to the children, the causes or underlying etiologies that is really unknown. So same thing here, the adult onset steel disease is also idiopathic disorder, and that is the cause are unknown. But it is stipulated that it is said that the infection is the most common trigger that can induce the process of, once again, inflammatory process that leads to the damaging to the different arthritis or joints and causing the arthritis and different presentations altogether. So what I'm saying that the infection is the most common trigger for the adult onset steel disease. Sometimes the disease is named rather than an autoimmune, it is said that auto-inflammatory disorder. And the different groups and different as well the different societies of rheumatology societies, they grouped into the disease that is called the idiopathic arthritis but happening in adult. Number one. And second they talk is the auto-inflammatory disorders, means the infection is the triggers. Yes, my dear doctor, let's see this gentleman, come forward. This gentleman presented with the arthritis. And he presented basically a monoarthritis of the left knee joint. Apni ekটু knee ta ekটু খুলে দেখেন। ডান knee-টা খুলে দেখেন। আস্তে আস্তে ক্যামেরাটা কিন্তু বেশি মুভ করবে না, হ্যাঁ? আস্তে আস্তে মুভ করতে হয়। Yes. So he presented with the left knee joint first, followed by the right knee joint. Within a days, yes, look at me. Within a days, he presented a bit of left knee joint, and then within a days, the right knee joint, the bilateral two joints involvement, and the definitive arthritis. The knees were swollen and having the temperature increased and having the tenderness and unable to move the right and left knee joints. একটু কথা না বলি বাবাজির একটু এটা কাজ করি। Yes. So yes, and immediately after the third and fourth admission days that we found that he has got also the right shoulder as well as the left shoulder joints involvement, having a severe arthritis, unable to move his every joints, including the both knee joints and the both shoulder joints, and also we have found some of the right ankle joints as well. So look at me. Yes, what we have done, my dear, we have found these joints are swollen, having tenderness, having the unable to move the two important joints. So we first thought about, yes, the first diagnosis should be the septic arthritis. Yes, my dear doctor, listen very carefully. A person having the monoarthritis presentation, the first diagnosis, first means the septic arthritis. Immediately after the septic, the first one, second one is an acute gout, third one is the acute shear gout, and fourth one is the hemophilia. So these 4 lists of diagnoses that we need to put in our mind so that we can work them together to get the diagnosis in our hands so that we can manage the patient immediately after that. So what we have done, my dear, we tried our best level to exclude all the possibilities that we have in our list of differential diagnosis. So either whenever the person comes with the acute monoarthritis, we need to do the aspirate the joint first. This is the first step that you need to know. Aspiration of the joints doesn't mean that you are doing the aspirate the fluid. It has the tremendous effects to have the inflammatory process as well, because it will reduce the fluid accumulated into the joints and it will ease the symptoms, means the pain will be relieved and the function will be improved. Along with that, we got the fluid and we sent the fluid for the study. We studied the fluid all together and we found some of the tests. So let's see what we have planned here. You see here, we started this one acute arthritis, but initially having the right or left was the more prominent, and we put the bilateral joint arthritis. And then we put the first diagnosis, the septic arthritis, second is the gout, third is the shear gout, fourth is the hemophilia. And some investigation found that ESR was more than 100, and some of the lymphocytosis and protein in the joint fluid that we found. So we have also another differential diagnosis to plan to exclude the TB arthritis. Just look at me. Look at me. My dear, listen very carefully. The tuberculosis is another important differential diagnosis that we need to keep on our mind, because the TB means, we say sometimes, the Bangladesh. So all the Bangladeshi peoples having the tuberculosis in our body, whenever the immunity is getting down, the TB is flared up, involving any parts of the body, especially the lungs and maybe the joints and in the different organs, even the limbs. So these are the things that we have found. So we tried to exclude the TB arthritis, means the TB as well. So let's see what work down that we have done. Yes, this is the synovial fluid that we aspirated, and we found some of the tests. You see the WC count 2000, and this is a lymphocyte count 90%. Having the lymphocyte count 90%, that we excluded the neutrophil is only 10%, not the predominant. So definitely it's not a septic arthritis. It is not a septic arthritis. So let's see the next part of the test. We found the glucose and protein, having some of the protein is high, 4.4. So definitely something, inflammation is there. So that's why it is inflammatory arthritis. This is diagnosed here by the protein. So having inflammatory arthritis but not done by the infections means the bacterial infection with the sepsis. So that is another way that we say this is the inflammatory arthritis. The next point you see, my dear. In CVC that we found the ESR is 104, means the 104, more than 100. So once again, the severe inflammation is going on in the body. Definitely the arthritis. So yes, the 104. So this is also having another clues. There is the severe inflammation in joints that is happening. Along with that, you see the WBC count is 14.9, as well as the neutrophil count is at 90%. So this is the neutrophilic leukocytosis. Definitely this is an inflammatory markers, and we try to exclude the blood culture, urine culture, the septic screen, and we excluded all the possibility of infections. So here is the CRP is 12, but is after the treatment, but we have the CRP is more than 100 as well. Let's see. This is the urine, there is no infections here, and this is the uric acid 5.76 and creatinine 1.93. So 5.76, a little bit high, not that much, causing the gouty arthritis. And here is also 13.2. This is the after the treatment, this one. And this is a random sugar and creatinine. And this is ESR 100T. We confirmed it, double confirmations by doing the ESR. And yes, we excluded the anti-nuclear antibody that was negative and anti-CCP antibody that was negative. I'll talk on later on what I'm saying. You see that we done the ferritin test, that is more than 1000. This is significantly very, very high. This is also the inflammations and active severe inflammation in joints that is happening. Next to that, when we found some of the anti-HCV that is negative, because we found some of the other tests of like the HbSAg was negative, you see here. The CRP, you see the 120, so ESR more than 100, CRP is more than 100, so this is the severe inflammation is going on. That is the initial found. You see there is a blood culture that we found nothing, no growth at all. And that was sent before starting the antibiotics. So definitely there is no infection at this moment. Next, that we found the APTT and PTS slightly raised. These are also the inflammatory markers as well. And these are the 16.1, the 89 after starting some of the treatment. I'm coming here. And this is the gene X part for the mycobacterial tuberculosis. With the synovial fluid, we found nothing, absent. So the TB is also excluded here. And here is an ADA, that is the synovial fluid ADA is also done, that is also negative, means less significant. So this is also excluding the TB arthritis. And we done the ultrasonogram having some of the intentions to look into the liver especially, whether his liver is enlarged, spleen is enlarged or not. But we found some normal in size, but having some of the homogeneous parenchymal echo texture. And we found the ALT 128, my dear, means the liver function test, especially the ALT is raised. So we worked on into the hepatitis B virus and hepatitis C virus. That was absolutely negative, so we just excluded the liver disease. And also ultrasound finding doesn't show that the liver disease. And we found the bilirubin level is 1.1. So this is just an ALT, is nothing but an inflammatory markers. And this is the creatinine is 1.63, slightly high. Along with that, you see that this is the urine culture that we try to exclude by doing the septic screen, means that infection is absent. Next to the test in the anti-nuclear antibody and anti-CCP is negative. The next test, you see, this is the culture in the synovial fluid that we try to get any of the infection, that is also absolutely absent. So the septic arthritis is excluded. Here is also the gram stain in AFB for the synovial fluid that is not seen. So AFB, once again, the TB is excluded here. Urine culture, we send it second time also to exclude the infections vigilantly. And having some of the APTT and PT is raised, that is due to the inflammations or some maybe the initial infection that raised, causing some of the APTT and PT raised. Yes, we done the rheumatoid factor is absolutely negative here. Once again, the first test, my dear, that is very much important. You see the ESR is more than 100, means 102, and neutrophil count is 92% and 70.2, means the neutrophilic leukocytosis here. And once again, the creatinine and HbA1c diabetes excluded here. And once again, synovial fluid protein 42, that is high, that is an inflammatory marker. And once again, joint fluid for polarized microscopy, that we excluded the MSUM, that is a masumine saying, there is a monosodium urate monophosphate, crystal is excluded, there is a gouty is excluded, and CBBD crystal is excluded, means the pseudogouty is excluded. Now let's talk, my dear, just look at me. What we tried actually, we have the differential diagnosis starting from the septic arthritis, next to the acute gout, next to the pseudogout, and next to the hemophilia. And after that, also the TB arthritis as well. Along with the other autoimmune disorders, starting from the rheumatoid arthritis at least, and the SLE group, all the group of disorder for the NR positivity that we try to exclude all them together. Means, my dear, the disease that I am talking about here, there is the adult onset still disease, is a disease of excluding the autoimmune disorders, excluding the other lymphoproliferative disorders, and excluding the other disorders, so that you can say ASD. My dear, listen very carefully. The Yamaguchi, a scientist, has given the criteria to make the diagnosis of adult onset still disease. And these diagnostic criteria that I can say here, just writing here, so that you can, to help you out. So what I'm saying that the adult onset still disease, I'm saying this is nothing but the ASD, the box. I'm saying this is box. It's a Sumanta sir's box, right? Yes. So starting with the A that I put, A means the first point, that is the arthritis, my dear, that you can remember. And these arthritis typically involving the knees, elbows, shoulders, sometimes wrist, very rarely, or maybe rarely the small joints as well. So the arthritis. And second S is really important, that is the spiking fever, my dear. Spiking fever. And Another rash that we need to remember, that is the salmon pink rash. Means the rash. Along with these three important criteria, and D, if I'm writing the D for W, we can write the W. Right, means the WBC count is more than 10,000. Some books are writing more than 15,000 is more predominant and more likely diagnosis. My dear, listen very carefully. Here is these all are the measure criteria, and measure criteria starts number 1, number 2, number 3, and number 4. Among the 4, it is said that more than 3 criteria is needed to make your diagnosis. So in this gentleman that we found the arthritis, we found the spiking fever, and we found the WBC count more than 10,000, more than 15,000. But we found no salmon pink rash, because I tried my best level to get searching any of the rash. He doesn't have any rash. Along with the minor criteria, there are a lot of minor criteria that I put the name, the Still's, the word that will be helpful to remember all the features of the Still's disease. So S starts with the sore throat. And S for the serositis. So yes, the person's having the sore throat. I said the infections can trigger the adult onset Still disease and also serositis, the next point. And as for another name that you can remember, the splenomegaly, another criteria. So the S bundle pack is the sore throat, serositis, splenomegaly. And then T stands on, you need to remember the T for 2, exclude at least the 2 diseases by doing the rheumatoid factor, and the anti-nuclear antibody should be negative. Will you put that on HLA-B27? All right, yes. And next to the S and T, there is an I. I for me is the iron profile. I say the ferritin. So here is an I also, itin or ferritin. So ferritin level should be more than 1,000. That is I, but it looks like to the 1, so 1,000. You must remember like that. And next is the L for, that is really important. L for LFT should be decreased, especially the ALT should be high. And next L for the lymphadenopathy, my dear. Sometimes the hepatomegaly can be presence. So these are the minor criteria. You see the minor criteria 1, 2, 3, 4, 5, 6, 7, 8. Among the minor criteria, at least the 2 criteria is needed, molecule 2, along with the molecule 3, means the total 5 criteria that you need to make your diagnosis, means the adult onset Still disease. Clear, my dear? So just look at me once again. So what I'm saying, my dear, making the diagnosis of adult onset Still disease, it does mean that you need to exclude. Number 1, I say the group of disorder that we call the autoimmune disorder or rheumatological disorders, all them together. Means that at least the rheumatoid arthritis and also the Sjogren's syndrome and some of the mixed kind of disease, all them together. And also some of the other disorders like the seronegative spondyloarthritis that you need to exclude, all them to means all the autoimmune disorders that should be excluded. And second is an infection with the septic arthritis, gout, shear gout, hemophilia, and also TB that we excluded. We tried all them together to exclude all them together. So Still disease, because of an idiopathic disorder, the causes is unknown. So we need to exclude all the group of disorders beforehand, saying that adult onset Still disease. And in the meantime, then we try to make the criteria should be fulfilled so that we can say adult onset Still disease, what does it mean? And we found in his case, he has got the, I said the AOSD that you can remember, A for arthritis, S for spiking fever, S for salmon pink rash, and D for WBC count. See, D for W, you can say yes. The WBC count should be more than 10,000 or 15,000. So among these 4 measure criteria that we found him, 3 important measure criteria. Along with that, we need more 2 criteria so that we can make our diagnosis. So we found the Still. What does it Still means? S for I said it. S for I said it. Sore throat. Second S for serositis. Third S for splenomegaly. And next T for the two important disorder, like the rheumatoid factor, means the rheumatoid factor should be negative, and another disease, the anti-nuclear antibody should be excluded. And I for ferritin, I said the iron profile. And once again, the L for LFT durance, and lastly the L for lymphadenopathy and hepatomegaly. That should be excluded, and also having some of the molecule 2 minor criteria so that you can diagnose early onset still disease. And we found the 3 major criteria. He has got typically the arthritis. He has found the spiking fever. We can show the fever chart. Yes, look at me, look at me. We have found the spiking fever, as well as we found the WBC count more than 15,000 at the initial point. And we tried once again. He has some of the two important disorder by the rheumatoid factor and also anti-nuclear antibody. And ferritin was very, very high, and the LFT was declined. So we got the 3 minor criteria, and also the 3 major criteria. Yes, you see that he has got the fever. It was a spiking fever altogether. Yes, after treatment he has these ones. Just look at me once. So yes, my dear doctor, what I'm saying now, after having the diagnosis of adults also still disease that we made the criteria, so we need to start the treatment, my dear. So what will be the treatment once again that you need to know? So I want to show once again the treatment is in here. So I can write the ASD itself is a box once again. What is the box for the ASD? Yes, the A stands for the analgesics, my dear. Should be the first line treatment. And these analgesics is nothing but the NSAIDs. I put the A is a box. Next, as for the steroids, my dear, is the next step. And D for DMRDs. My dear, this is not only the mnemonics, this is also the stepwise management planning. Means you should start with the NSAIDs, means the analgesics, and S for steroids, and D for DMRDs. Or sometimes you use the steroids because having the severe arthritis involving more than 4 or 5 and polyarticular. So in that case, the DMRDs and steroids should be used altogether. And next to the 3 and 4 and 5, my dear, I would like to talk another 3 important drugs. These are really important. What is that? Next to the drugs, there is the, you need to remember, I'm saying the A for, the another A bundle packs, there's the anakinra. And anakinra having the I, so this is nothing but the IL-1 inhibitor drugs. Anakinra is an interleukin-1 inhibitor drugs. Next to the anakinra, the another drug that we need to remember, there is the anti-TNF alpha blockers. And these anti-TNF alpha blockers like the infliximab, there are a lot of drugs, etanercept, adalimumab. And next to the another A bundle packs, the last drug, there is the anti-CD20. I call it anti-BD20, the bituximab or rituximab. All right, it will be another lecture so that you can understand the drug's name altogether. So I said the anti-TNF, anakinra, and also anti-CD. So these are all A bundle packs, my dear. So now look at me, my dear. What I said, my dear, this is a severe arthritis, and the disease itself is the auto-inflammatory disorder. Means the infections can be the trigger, and that can start the inflammatory process, and that causes this inflammatory arthritis and also some of the other features. But the treatment should be started A for, I said, analgesics with NSAIDs, second S for steroids, and third D for the DMRDs. And these are the stepwise management plan, and the second bundle pack for the A is all together. Immediately after the DMRDs, somebody says that you can start for the anti-TNF alpha blockers. I say the TNF alpha blockers, T for tinfliximab, means the infliximab, because the tinfliximab is the TB reactivation is another cause. We don't use in Bangladesh especially, because the Bangladeshi people's having this TB in their body, so TB flared up can happen, so that we don't use the tinfliximab, means the infliximab, means the TB reactivation, there is a chance. And next to the anti-TNF and blockers, there is the anakinra is really important. Anakinra is really important. Why? Because this disease is strongly associated with the interleukin-1. So if you can stop the interleukin-1 by inhibiting them, so having some of the role playing in the disease process and modifying and having the good impacts in the long-term treatment. So next and last is the anti-CD20. That is nothing but the rituximab. These are the treatment. So these three A's, the more advanced drugs that you can remember. So I say the anti-TNF, anakinra, and last the anti-CD20, which is the rituximab. Yes, my dear doctor, so what is the summary talk? So early onset stale disease, as I said, is an auto-inflammatory disorder, and you start with the diagnostic criteria. There is the more equal 3 major criteria and more equal 2 minor criteria, means the put together the 5 criteria should be met before your diagnosis. As I said, the AOSD bundle packs, A for arthritis, S for spiking fever, S for summon ping, and D for WBC count. And next is steel, serious muscle, S for sore throat, serositis, splenomegaly, T for to exclude the rheumatic factor, ANA, and also I for ferritin, and L for LFT and L for lymphadenopathy. And putting all them together make your diagnosis, and after that start the treatment. Once again, A as D, A for analgesics, S for steroids, and D for DMRs. After that, you can start with the anti-TNF alpha blockers, along with that, yes, what I say, anakinra, and last one, what is that? There's anti-CD20, is the rituximab. I hope that you enjoy, and best wishes for these guys. Thank you very much. Thank you.